He is certified by the American Board of Holistic Medicine and has been practicing holistic medicine since 1985. Dr. Rin started his medical career as an anesthesiologist. From there, he moved into pain management and finally to holistic medicine. He has developed expertise in areas of sports medicine, endocrinology, including all hormonal concerns, repair of brain injury, especially after stroke, and women's health. Dr. Rind has taken additional training in a variety of alternative medical therapies. Dr. Rind's treatment approach is holistic. He completed his full osteopathic training for MDs at Michigan State University of Osteopathic Medicine. He has completed a 3-part British program of Cyriax techniques in orthopedic medicine. Further, Dr. Rind is an assistant professor at Howard University College of Medicine. Visit his website at www.drrind.com. Let's give him a warm welcome.
Thank you. I put this slide on over here in case anybody was, while you're waiting, to take a look at what cell phones do to you. This is thermography, and we'll try that. Is this any better? Wonderful. Anyway, this is, I just put this up for anybody who's curious. This is a thermography of somebody. Baseline, after 5 minutes of just listening to a cell phone, and this is after 10 minutes, and her entire head went up in temperature by 2 degrees Fahrenheit and another 2 degrees. That's 4 degrees Fahrenheit total in 10 minutes. I just thought some of you might find this interesting, whoever is using cell phones. It's like sticking your head in a microwave oven. Notice both sides of the head are equally warm. And I just did this because she was using her cell phone a lot. And I said, let's see what you look like when you do that. I'm going to be flying through these slides because there's really not enough time to go through everything as I would like. Okay, so disclaimer. One of my favorite philosophers, Yogi Berra, in theory, there ain't much difference between theory and practice. In practice, there is. Hormonal problems, how common are they? It seems like most people are suffering with them. And most doctors don't recognize them when they see them. A person comes in, they're pale, they have cold hands. They say, I have palpitations, I have anxiety, and the answer is usually, oh, take a Prozac. It's important to ask your doctor's question. And questions are a very good screening tool. If your doctor doesn't want to answer them, you know you're not in the right place. You need to ask yourself, how do you feel about the interaction altogether? Have you had your questions answered? If the doctor doesn't answer your questions, it usually means they don't know the answer. So they've just told you, I'm not the right person for you. I have this hanging on my wall in every treatment room. And hang on. You could read it. Now, it says, best physician is you, medical professional is your consultant. If the above is forgotten, you're the one that's in trouble. You find a doc with a positive attitude. This one, he's looking at this guy, he's glowing, and he's saying, you've been fooling around with alternative medicine, haven't you? And most of my patients tell me they've met this doctor over here. He's telling him, I've originally given you 6 months to live, and I've extended it twice. You can't keep coming back to me like this. I'm sure many of us have met this doctor. I'm going to be talking about 3 things today, really. One is hormonal, the thyroid adrenals. Can't hear me? I'm sorry. Okay. Are we better now? Okay. so I'm going to be talking about several things. One is the thyroid-adrenal connection, very important, and the other is what's the, Lyme, and what's that connection all about. I'm going to fly through some of these because I have so much material to cover that it's about 5 hours of work that I'm doing in just an hour. The adrenals are little glands, they're pyramid-like glands that rest on top of your kidneys. They produce many, many, many hormones. They help us deal with stress. These are hormones, for example, cortisol, adrenaline, mineralocorticoids, sex hormones, pregnenolone, DHEA. They produce so many hormones that most doctors just get lost with it and they say, oh, the adrenals are not really important. They don't want to deal with it. It's better to deal with one gland that produces one hormone. Much easier. So the main job of the adrenals is to deal with stress, which means stress is a need for adapting, and it has everything to do with survival. So we can define stress as anything that threatens our existence, survival, security, joy, ability to thrive, stability or centeredness, or requires adaptation. So we could have emotional stress, social stress, thermal stress, hormonal, chemical, physical, etc. Not sleeping enough, for example. The thyroid helps us produce the molecules of energy, and there's an inverse relationship between the thyroid and the adrenals. What that means is that a low one looks like a high other. Let's see. Okay, for example, if a person comes in and they are heavy, red-faced, slow, sluggish, I don't know if they're hypothyroid or if they're high adrenal. If somebody comes in and they're pale, thin, nervous, I don't know if they're low adrenal or high thyroid. One looks like the opposite of the other. So the way we present ourselves is really a matter of how the adrenals and the thyroid relate to each other. What is their balance? If the balance is perfect, we end up looking like we're normal, healthy people. If it's too high in the direction of thyroid, for example, or too low in the direction of adrenals, we're nervous, we're pale. And if it's in the other direction, low thyroid, high adrenals, we might have a flushed color, we might be stocky. Okay, if the body were a car, the thyroid would be producing the energy, the adrenals would have to be managing that energy, like the driver. So why is there confusion? Because the majority of low thyroid conditions are also accompanied by stressed adrenals. So if the adrenal problem isn't recognized, the symptoms tend to be attributed to the thyroid alone. In a purely thyroid or purely adrenal condition, the differences become very apparent. So what happens is that if somebody comes and they've just had their thyroid removed, they're totally normal, doctor thought they had cancer, or maybe they had cancer, they removed their thyroid, and they're hypothyroid, but nothing else. They're not being adequately replaced. Their reflexes are very slow. What I will find is somebody with a red face and warm hands, actually warm hands. Unfortunately, because low adrenals produce cold hands, and most of the time we have a patient with low thyroid will also have adrenals that have been stressed out at some point. A lot of times they will have cold hands. And so you look at your standard textbooks in the medical literature, and they'll say, low thyroid, cold hands. You look in your in the internet, and that's one of the descriptions they do. So there's a lot of confusion, and that's because a lot of people just assumed, oh, low thyroid, cold hands, okay, that's always what it is. But it's really just an association. It's not, one is not causing the other. And it's like that for many other things as well. And then you have the blind leading the blind. Everybody's reading everybody else's literature instead of just simply looking at it for themselves. So pure hypothyroid, and by the way, when I was trying to figure this out, when I was trying to sort this out about 15, 20 years ago, when somebody came to me that was pure hypothyroid or pure adrenal, they were a treasure. I spent a tremendous amount of time trying to learn everything I can about them, because you didn't have the confusion of the two different things overlapping, which is over 90% of the time. You have hypothyroid, you have warm hands, poor heat tolerance, not poor cold tolerance, as is often said. Most of the things you see here are opposite in most of the literature you read or the internet. They have a low but stable body temperature. Everything is very stable. The adrenals aren't being stressed, so we're very stable. Heavy build, redness, rubor, sparse eyebrows. They tend to start missing the outer edges of their eyebrows, and it works its way in over time. We have slow moving as opposed to the nervous type, which is low adrenal. We tend to have fullness or puffiness around the eyes and coarse hair. In the pure hypoadrenal patient, we have just the opposite, cold hands, poor cold tolerance instead of poor heat tolerance, low and unstable temperatures, because if the adrenals are not strong, we have instability. We have pallor, pale face, fine hair, thinning hair, straw. The eyes become hollowed out. We tend to have a thin build. Of course, there's no perfect, and everybody's a mixture of something usually, so you're not going to get a perfect example of one or the other. But we have the ectomorph versus the mesomorph, mesomorphic being a stocky football player. So for the women with weak adrenals, often, if they're chronically weak adrenals, we often see, flat chest, mitral valve prolapse because they have very weak connective tissues. With the men, also thin, prone to joint injury, orthopedic injury, flat feet, because even in women, because the arches, the connective tissues are so soft that they start to relax, and we have fallen arches, splayed metatarsals, and we end up with bunions, etc. Here's a good comparison. Two employees of mine, one is low adrenal and the other is low thyroid, and I think it gives a pretty good presentation of what we can expect roughly. By the way, when I took this picture, I told her, let me make sure I take a picture of you before we fix you. And then after she got fixed and she became pink and she gained a little more weight, then I couldn't do that anymore. So this is a summary, and you have this in your handouts, and you could get it from the website also for handouts. Interestingly enough, if you take a look down at the mood, very stable, low thyroid, stable but depressed. Low adrenal, unstable. Mood, as far as depression, anxiety, they're two opposite ends of the spectrum, if you notice. They're two opposites. We have, as far as the immune system, hyporeactive, which means we get infections. Hyperreactive means we get allergies. And people can have a little of both. We can have the lipids the cholesterol tends to be very high in low thyroid. Usually it's the thyroid that causes the cholesterol problem, and cholesterol is not a problem. Cholesterol is an indicator of a problem, as our former speaker said. It is not a problem. But if the thyroid is low, the cholesterol tends to go up, and that gives me a clue that we have to fix the thyroid, actually. If the cholesterol goes low, usually it's the adrenals, and that's as bad a problem as anything, because these people tend not to do well either. We don't want the cholesterol too low. I'm sorry? Sorry? Let me try this. I'll try everything here. Okay, are we good? No? How about now? Sorry. Okay, so anyway, cholesterol too high is an indication of a problem somewhere else, such as weak thyroid. It's not the cholesterol that's the problem, it's the thyroid that's the problem. There was a cardiologist about 30 years ago, did an experiment in his office, and if you walked in on 1 week, everybody would get a low-dose Armour thyroid. If you walked in the next week, it was just the usual treatments. Both groups got the usual treatment, but half his patients had the Armour thyroid, very low dose, and the other half didn't. And they had it whether they needed it or not. After 10 years, he looked at his statistics. He found that the group that had the tiny amount of Armour thyroid had 90% less cardiovascular incidence than the group that didn't. It's a thyroid. It's not the cholesterol. Again, intolerance to heat, warm hands and feet versus cold hands and feet. Again, all these things you have written down. I don't have to mention it. The build, heavy versus thin, etc. This is what the labs would tend to look like. Cholesterol going high for thyroid, low for adrenals. Sodium, high for thyroid, low for adrenals. Potassium is the other way around. It's low for thyroid, high for adrenals, etc. We have all these things in here. I don't have to read them to you. As far as the strong adrenal, weak adrenal, I like to call them, the bulls and the butterfly. The strong adrenal is like the bull, and the weak adrenal is like the butterfly. The bull usually are guys. Usually they have strong adrenals. Women tend to have the weaker adrenals, sorry. And maybe they're under more stress, more demands, but that's how it is. Usually, not always. Sometimes it's the other way around with some couples. Skin tone for weak adrenals. Light skin tends to have weak adrenals. People with darker skin tend to have stronger adrenals. That's just been my observation. If they're Mediterranean, they have stronger adrenals. If they're African origin, they even have stronger adrenals usually. Fluids, the thin types, weak adrenals. The butterfly, you think of the butterfly as being dry and dusty. The bull as being, moist and wet and strong and warm body. The blood types for the weak adrenals, they tend to be a lot of them are A's, whereas the strong adrenals, a lot of them tend to be O's. They have the perseverance. Butterfly has very poor perseverance. The bull can work hard all day. The butterfly tends to handle medications and alcohol poorly, whereas the bull can handle anything and nothing happens. The butterfly startles easily, and the bull normal startle, or actually low. And one of the interesting thing about them also is that the butterfly, this is just an interesting observation, the butterflies tend to be more intuitive. You think of approaching them and they already fly away. The bulls tend not to be intuitive. In fact, they often tend to be a little more dense. And a 2x4 on a head usually doesn't give the message across. It's just they don't get it. And interestingly enough, the butterflies and the bulls very often find each other and get married. And they need each other. The bull says about the butterfly, I don't know, it's just, I need her, I don't know why. It's a spiritual connection. She connects him to the astral, and he connects her to the ground. And he says, well, she's a little flaky, but I love her. And she says, he's so dense, light bends around him, but I love him, So, okay, so general treatment principles, if you're going to fix the adrenals, in fact anything, is make sure you remove the impediments to good health. Replace nutritional deficiencies, remove stresses, whether they're physical, chemical, etc. Removing of toxins is extraordinarily important. I'm going to show you later what I discovered when I went down to the Amazon about living a non-toxic life, and get rid of anything that's impeding. Clear out infections, make sure oxygenation is good, make sure you have adequate rest and sleep. If you just take care of some of these basic things, it's amazing how many good things can happen. If we support the body's physiologic efforts to heal. There are many things we can do to support the adrenals in the short run, while we're getting our life in order and becoming less toxic and more promoting of good health. We could use glandular extracts to support the adrenals, even thyroid. A lot of times I find that there are some glandular extracts that do better for me than if I were to use the prescription items. Or we could just take the easy way and cover up all the symptoms of drugs. This cartoon, he says, the red ones are for the symptoms, the blue are for the side effects of the red, the green are for the side effects of the blue, etc. It seems that drugs are getting around to everybody. I'm on a pacifier patch. The baby says to the other. What about estrogen dominance? There's a condition which most of us suffer from, women and very often men too. It's called estrogen dominance. It's a condition in which a woman can have excessive, normal, or deficient levels of estrogen. You don't have to have high estrogen to be estrogen dominant, but has too little progesterone to balance out the estrogen level. It means a predominance of estrogenic effect as opposed to the progesterone effects. The bottom line is this. If you think of the body as a car, the estrogen would be a stimulant. It's like the accelerator. Progesterone is a calmer. It's like the brakes. And you have to have them balanced with each other. If you're driving down a city and your accelerator is too strong, you might bang into a lot of people's backs. But if your accelerator is normal and your brakes are too weak, you're still going to bang into people's backs. So it's the balance between them that matters. It's not how much of each you have. It's the balance between them. If a woman has too much estrogen for one reason or another, but also has too much progesterone, she might actually balance out. Not a good thing to have too much of anything, but can look quite normal. So this is what I was just saying. The balance is what matters. Symptoms of estrogen dominance, and I only put the main ones here. There's so many. But notice that they all have to do with overstimulation. For example, if we talk about the muscles, we can have cramps, whether it's uterine or whether it's in the muscles of the body. We talk about the mind, we're talking about anxiety, irritability, anger, agitation. If we talk about breast tissue, too much activity, and we can get fullness and tenderness and pain. If we're talking about the immune system, we could be talking about excessive irritability of the immune system. We're talking about allergies now. Of course, if we overbalance with too much progesterone, we now have not allergies, but we can have infections. One of the ways you know that you took too much progesterone is you do that for 1 or 2 days and you start getting a yeast infection and you say, whoops, my immune system is a little too relaxed. So whatever the estrogen does, the progesterone does the opposite. So in the mind, you have calmness, relaxation, and enabling sleep. In the muscles, relaxation, etc., etc. We have a short list over here that compares them, estrogen versus progesterone, insomnia versus sleep, agitation versus calm, weepy versus stable mood, focus, overactive versus, poor focus and overactive over, as opposed to focused and calm. Interestingly enough, the extremes of both, as far as weight goes, they could both make you heavy. Too much estrogen can stimulate too much fat production, whereas too much progesterone can calm down the metabolism so much that we start to gain weight that way. Bone, here is an interesting one. They're opposite and complementary. So the estrogen decreases bone loss, while progesterone increases bone buildup. They're both complementary to each other. They both do opposite, but work towards the same goal in this case. So estrogen dominance is usually due to a deficit of progesterone rather than an excess of estrogen. And very often the reason is because the adrenals become so stressed out trying to keep us alive, trying to keep us healthy, that they end up using up a lot of the progesterone that's being made. And the progesterone gets used up by the adrenals, not enough to go for balancing out the estrogen, and we get estrogen dominance. Another term for estrogen dominance is PMS. But the PMS can be 24/7 for the whole month, too, if you're deficient throughout the month. Some of the common stresses that cause estrogen dominance, stress, which causes excessive cortisol, displaces progesterone. You can have xenohormones, using the wrong estrogens. Birth control pills, really big, because they signal to your body that you're pregnant, don't make any progesterone, and the progestin, the fake progesterone, which doesn't act like progesterone in any other way in your body, just occupies the space. So the body stops making a lot of progesterone. We measure their progesterone levels, it's very low. And that's because they're in birth control pills. And then they wonder why they're having poor tolerance of stress and why they're having all kinds of other stress-related issues. Some of them, depending on your own physiology, can be weight gain, agitation, irritability, allergies, all kinds of things can start to happen. I've heard of virtually every symptom with these birth control pills. Poor diet, of course. As far as thyroid goes, we have 3 hormones. Let me see if I have. We have 3 hormones that we are dealing with in the as far as the thyroid goes. We have more hormones, actually, several, but the main ones are TSH, which is thyroid stimulating hormone, and that is the hormone produced by the pituitary to tell the thyroid gland, hey, make more hormone or less hormone. The pituitary sniffs out how much hormone do we have, how much do we need, how much can we tolerate, does the math, and then says to the thyroid gland, I want a little more, I want a little less. And it'll either raise the TSH to raise the demand for thyroid hormone or lower the TSH to lower the demand for thyroid hormone. The thyroid gland will then make a hormone called T4, which has 4 iodines on it, and that's sort of like a reservoir. And the body then converts that to 2 kinds of thyroid hormone. If it takes out this iodine right here, we have T3, which plugs into the receptor in a cell and turns on energy. So T3 is a stimulant energy. If we want to lower our energy, we take off this iodine, and now we have reverse T3, and that lowers or inhibits our energy production. So the way the system goes is we have a certain level of energy. The pituitary sniffs out how much we have, how much we need, how much we can tolerate, tells the thyroid, okay, make this much or that much. The thyroid makes the T4, and we make so much T3 or reverse T3 out of it depending on how much we need. It's sort of like driving, a little accelerator, a little brake, a little accelerator, a little brake, and we do that throughout the day. And the TSH that is usually considered normal by most doctors, and that's because the laboratory result, the piece of paper they get, says between 0.5 and 5.5 is the normal. So if you're 5.4, they say, go home, take a Prozac, it's nothing wrong with you. And what I did was I did my own experiment with my patients. I wanted to know what health looked like, because we study in medical school, we study about disease, but nothing really much is talked about health. It's like if you're normal, you're okay. When you're having a problem, you're crawling on the floor, okay, let's see what we can do for you now. Which drug is good for you? So what I did was I looked at my patients that were extremely healthy, my athletes, and very, very healthy patients. And what I found was that we have 0.5 to 5.5 is the normal for TSH. What I found is that they had a sweet zone outside of which they could not function effectively as an athlete. They would not be able to perform effectively as an athlete. And that sweet zone was a very narrow range of 1.3 to 1.8. And at that particular level, they were able to function very, very effectively in their sport. Outside of that range, they start to function poorly, but for most doctors, if you're 0.6, just above the 0.5, or if you're 5.4, didn't quite fall off the cliff at the other end, you're normal, go home, take a Prozac. Now, according to this British Medical Journal article, what they found is that the recommendation for thyroid was by the American Association of Clinical Endocrinologists. That this was in 2001. They said that 3.0 is probably the upper limit, and there are many places that use lower numbers as an upper limit. But again, it's not. You don't want to be too high. You don't want to be too low. But certainly, you don't want to be a 4 or a 5, and then your doctor still says you're normal. So remember my first sign over there, it says your best physician is you. Keep that in mind. Don't go to the doctor who says, hey, at 5 you're still normal, go home, there's nothing wrong with you. And you know, the reason you're gaining all this weight is because you eat like a pig and you don't exercise. And that's, a lot of my patients, they tell me this is what they hear from their doctors, you know, and it's really offensive when the doctor is the one making the mistake and missing the boat. So what we have here is what most doctors see over here is normal versus abnormal. The black section is abnormal. And what I'm using is a sliding scale, and you just see where the optimal zone is, and the further you get from the optimal zone, the sicker you are. And you're trying to get people to be in their optimal range. Here's a nice little cartoon. He's telling her, good news, your test indicates that you're in the normal range, as she is laying there on the floor. This is an interesting, this patient, Tim Guarino, is a patient that came to me, and he said he was a weightlifter, and on the side he was a fireman. He said, I want to retire, I want to have build a gym, and he said, I need to be able to participate in at least one championship event, so I can have some kind of a name, and I can't even enter the competition because I'm too weak. He said, I'm a good weightlifter. I know I'm a good weightlifter. So he said, I went to 3 endocrinologists, and they all told me that my thyroid was normal, and therefore it must be in my head. And he came to me as a last resort. I looked at him, I said to him, your numbers are normal, but they're not optimal. So all I did was optimize his thyroid, and he was able to enter the competition several months later, 2-3 months later, and he actually was the champion. He took the gold medal in the U.S. championship. Over here we have a list of what are these things, what do they mean, and we talked about that, the T3, T4, TSH, and reverse T3. Sometimes I have patients take a temperature graph. It's on my website, the blank form, and this explanation right here. And as we can see, the first section, which is low but stable temperature, is hypothyroid. If it's low adrenal function, we get low temperatures on the average, but we get very variable temperature. As health improves, we start to see more stabilization. It rises, and then over here in this part right here, sorry, I can't do the other side. It becomes more unstable and suddenly drops. That's an expansion pattern. That's if something happened to the person's health and they're not doing as well. And then it becomes stable at a lower, and of course if they end up at the top line, which is stable, the very, very first part where you see excellent health, we're in the beginning of the chart. We have just stable 98.6, give or take 0.1 or 0.2 usually. This is a graph of a patient that came to me, had very low unstable temperatures. He needed both thyroid and adrenal support, and you see over time his temperature graph just kept on rising and becoming more and more stable. Eventually he did become pretty stable, close to 98.6. Common thyroid tests. A lot of times the doctors will want to use a TSH only, and they don't want to know what the T4 or T3 is. That's usually because they don't understand what the T4 or T3 are, and it's up to you to help them. I had a patient recently, and she said she went to an endocrinologist, and the endocrinologist said, well, I'm going to check your TSH. And she said, what about T4? She said, okay, I'll do a T4. She said, what about T3? And she looked her right in the eye, and she said, frankly, I don't really know what the T3 does. So my patient said, would you like me to explain it to you? And I think that was the end of the relationship, somewhere around there. But no, my patients are usually pretty spunky. I try to encourage them. I tell them if they're not a pain in the butt to most doctors, then they're not doing their job as a patient or as their own doctor. The T3 uptake is a very interesting test. It's a lot of doctors take it because they think it measures T3. It actually measures nothing. I mean, literally. If you say, am I getting healthy or not? And I said to you, let me measure how many shoes there are in China, and then I'll tell you if you're getting healthy or not. That's about the relationship of T3 uptake. It doesn't measure anything. The only thing that it's good for is to find out if your doctor knows what they're doing or not. It's based on old technology where they thought that if they took your blood proteins and they put in T3, if you were low on T4, your sites on the protein would still be vacant because you don't have a lot of T4, so you would take up all this T3. So there's an indirect way of measuring T4, which later we found out didn't work. So it's an indirect way of measuring T4, so it's called a T3 uptake to see how much T3 the protein takes up. And a lot of doctors just think it's measuring T3. It has no connection, no relation to T3. The T3 in the name has to do with the substance that they're putting into the blood to measure something else. T3 uptake. So when your doctor measures the T3 uptake, you might want to educate them on that. I just want to share with you a little something about, sometimes people measure T3, T4, and a lot of people say, well, is it better to measure free or total? It's better to measure free. The free is the active form and actually relates to what physiologically this thyroid is doing in your body. If you want to know what total is and free, I'll show you on this slide right here. We have these little brown splotches, let's call them proteins. The blue dots are T4 and the green dots are T3. And if you take a look at the total amount of blue dots, T4, on this screen, those that are attached to the protein and those that are free-floating in the serum, you will have your total T4. If you want to, but the ones attached to the protein are not active. They're not doing anything. And about 99% of the protein, of the hormone, is attached to protein. The ones that are free-floating in the serum are the free, and that's the one you want to know because those are the ones that are able to interact. Another way of looking at the difference between free and total is if I walk into a room and I'm allergic to dust, and as soon as I breathe in a little dust, I start to sneeze. There are two kinds of dust in the room. That which is stuck to the furniture, and that's called the protein, the furniture, and that which is free-floating in the air, like the serum. It's free-floating in the air, serum. And the protein that's stuck to the furniture is not going to make me sneeze. It's not active. But the protein that's free-floating in the air is going to interact with me and is going to make me sneeze. So it's the free hormone that you're interested in to see how much of that you have. And that's really the more accurate way of doing it. Let's talk about some principles of thyroid repair. First of all, before we give thyroid, one of the bigger stressors, probably the biggest stressor to the adrenals, is metabolic energy, thyroid. That's why when the adrenals are stressed out, one of the first things that happens is our thyroid gland downregulates. Our body downregulates our thyroid energy, and it goes down. We have a low T4. Well, first we start with low T3 in acute phase. But if it lasts for a long time, our body says, why should I waste my energy making so much T4? It starts to make lower T4. And all the while, it's making a high level of reverse T3 because we're stepping on the brakes. We're trying to block the metabolic energy from burning out our adrenals. So if we're going to be replacing thyroid, we first have to make sure that our body can tolerate the replacement, that it can tolerate the support. Otherwise, too much metabolism and our body will just do everything it'll waste a lot of energy trying to block this excessive energy from burning out the adrenals. So, okay, evaluate the problem, make sure the adrenals can tolerate, and give the body what the body needs. That's a general rule for almost anything you do. Give the body what the body needs and take away the stuff that it doesn't want. If T4 is missing, make sure you just give T4. If the conversion of T4 to T3 is poor, then you give a little support with T3 as well, such as Armour Thyroid or slow-release T3. I never like to use fast-release T3. Brand name is one brand name is Cytomel, for example. It's fast-release T3 because it, again, remember Yogi Berra in theory, there's no difference, but in practice there is. So what happens with T3 is this. T3 is the energy part of the thyroid, and even though the half-life is about 3 days, it behaves as if it comes in a blast. You have a high level of energy, and suddenly a few hours later you have no energy. It behaves as if it's a very, very short-acting thyroid support. And regardless of what the blood level is, that's how it behaves. And it blasts the adrenals out. The adrenals like a steady state of energy. They don't like fluctuations, too high, too low, too high, too low. And every day we go too high, too low. That's why I use the slow release. Another way of putting it is this. The amount of energy released by a candlestick is the same, burning, is the same as the amount of energy released by a stick of dynamite of the same size. They both release the same amount of energy. The difference between them is how long it takes to release that energy. Is it a thousandth of a second, or is it 10 hours? And that difference is where the behavior is seen as so different. And it's the same thing with the body. The body likes a candle. It doesn't like a stick of dynamite. So I don't like people taking in little firecrackers every, once a day. Here's another very important principle which you're going to find there's a problem with. The lab tests need to be compared with the physical finding. Each is equally important. This is a problem because doctors today are not being taught this physical examination very much. It's not being emphasized very strongly. And most of my patients, I know this because my patients, most of them, when they come in, they say their doctor never touched them. That's how I know. And looking at one without the other only gives you half the story. It's sort of like the body feeling hot versus the body being hot or feeling cold, etc. You could have a fever and you're chilled. You feel like you're chilled. So we have to really look at both sides of the story. Again, if this was a car, what the thyroid lab test tells us is sort of what the gauges on the in front of us tell us. And the reflexes that we check, or the physical appearance, etc., that's sort of like looking out the window and seeing how fast things are moving by us. So if I see the speedometer saying that I'm going 60, but there's a little old lady walking past my car, chances are that there's a disconnect here, and I have to really find out what is going on for real. And most doctors will just look at the lab results and assume that the lab results are giving them the whole story, and they don't even bother looking at the patient. To make it even worse, as they say, the plot thickens. What happens is that they look at the labs the way I showed before, which is like this, black and white, and they say, "Oh, you're normal." And that's the end of it. They don't even check you to see if your reflexes are super slow and if there's really a reason why we're sleeping too much or gaining weight or can't think or getting infections, on and on. That it's not all in our head. Somebody once asked Jeffries, the doctor that wrote the book on safe use of cortisone, a question which I loved his answer. They said, he was saying how difficult it is for most doctors to assess bad adrenals. And somebody asked him, is it that the tests are inaccurate? And he said, no, the tests are extremely accurate, and they're getting more accurate every year. The problem is not the data. The problem is with the doctor's interpretation of the data. I have a video, one of these self-teach videos that you can check your reflexes at home if you want, and it's in your handouts. It's http://gallery.me.com// Dr. Rind, that's DRRIND /1000030. That's 10030. And it's just a I'll probably put this on YouTube later. It's just a video that shows you how to check your reflexes, and I'll probably be putting on a different one, which is more complete. This is a rough, but good enough video for now. By the way, if your lab test says that you're hyperthyroid or normal and your Achilles reflexes are saying super sluggish, you've got a problem. There's another reason for this video too, and that's to help doctors really to learn how to do the reflexes properly. And one of the things I found is that if the reflexes are checked very, very carefully, what I often find is not only whether they're brisk or slow and sluggish, but I found that by comparing right and left, the right arm, right knee, right ankle, left ankle, against each other, I often will find asymmetry. And one of the things I discovered this year was that many of my patients with Lyme, I'll be talking more about Lyme later, but many of my patients that have confirmed Lyme disease, in fact virtually all of them, will have asymmetry of the reflexes which crosses the midline. In other words, the right elbow might be the more brisk, whereas the left ankle might be the more brisk, or the left knee. In other words, it crosses the, it's not like a stroke where you have all the right side brisk or all the left side brisk, but you have them crisscrossing. Not only that, or you can have, for example, the right elbow is brisk, the knees are equal, exactly equal, but then the right ankle is brisk. In other words, it's again both are on the right side, but the midline in this case is a horizontal midline. The bottom line is it doesn't make sense neurologically, and what's even more interesting is that very often this asymmetry will fluctuate. Next time the patient comes in, the left one might be the more brisk and the right one is not. And you take a double take. In the beginning I thought my technique was bad, and I kept on questioning myself, how can I be so off? And I finally put them together, and I realized, and one of the things that I realized is that when I treat them for Lyme, as they get better, I could see the reflexes becoming more and more stable, more centered, more symmetrical. And when the reflexes are completely symmetrical, that's when we're halfway there. The other half we could see with other lab tests and their symptoms. But what I found is that the reflexes are really quite an interesting early indicator, and you could tell if the treatment is working or not by checking that. And again, this is just my own finding. It's nothing official, but I found it extremely consistent with most of my patients. Okay, so some of the things that we look at as far as the physical exam, facial colors and tones. You can look at the adrenal burden by looking at the facial colors. If the adrenals are not tolerating what's going on, we become very pale. We develop a lot of white around our mouth first, and then it expands outward. But that pallor is a sign that the adrenals are not handling things. And I first noticed that when I was an anesthesiologist, as I would be called to crisis situations, and I found that I could see when people are about to faint that white circle around their lips expanded and became wider and wider, and if it became wide enough, there you go, they lose consciousness, they faint. As they came back from fainting, as they were resuscitated and started to feel better, the color would start to come back to their face, especially if you lift their legs, and that redness would start working its way towards the lips again. So you look at people, you see the white ring around their mouth, that's their adrenal stress level. Now you'll never be able to go to a party and look at people again the same way. Sorry. So here is somebody, the person on your left is 0% pink, whereas the one you see near the nostrils, a little bit of pink, that's about 30% of the entire upper lip, that's pink. So I just rate that as 30%. Over here we have, again on the left, 50%, and it looks like a wide white ring, whereas here's another one with 80%, for example, and it's mostly pink and a little bit of white around the lips. and this is 100% pink. And again, this person right here that's 100% pink might be someone with extremely good adrenals. Or maybe their adrenals are not so good, but their thyroid is so bad that it's not stressing out their adrenals at all. So this is reflecting a low level of adrenal stress. Remember I told you that the thyroid and adrenals relate to each other, and that's how our physiology presents itself. Here we have somebody, again, with 0, and if this person would have a sinusitis, there would still be a 0, but the pink is sort of in the center of the upper lip, and that's a sinusitis pattern. I took some pictures to show everybody what these might look like in real people. And over here, I don't know if you can see it. Is it visible? No? If it's not visible, we'll just go to the next one. Okay, here we go. This one over here is 30%. You could pretty much see the upper lip. The upper portion is pink, and the rest of it is pale. Is everybody able to see that? Okay, thank you. Here's another one that's 20 years old, male, 70% pink. And I exaggerated the colors at the bottom just to show you where it is. Here is, in dark-skinned individuals, we very often will have a white line around the lips. So you see that, can you see the white line? Yes? Okay, good. It's sort of like a pale line around the lips. Again, here's another one, pale around the lips. This here is a sinusitis pattern. You could see that the entire upper lip is pale, but there's a little triangle near the nostril, pink, and that is sinusitis. This is 50% pink, and you can accentuate the white area by puckering up, pursing the lips, and you could see the white pink more exaggerated, and if you notice, that's where the wrinkles live. The more pink you have, the less wrinkles you're going to have, ladies. So just point of interest. The more white you're going to have, the more wrinkles you're going to have, and that's where they're going to be exactly in those locations. Fingerprints reflect collagen, the protein. I can't look at the protein of your bones. I can't look at the proteins of your ligaments, not without surgery, but I can look at protein in other places of the body, such as the fingerprints. And if they're deep, then we've got good, strong, thick protein, whereas if they're thin, we don't. And the quality of your protein corresponds to everything in your body. It's just, there are some places we could see it directly and other places we can't, but the assumption is that the whole body is made of the same quality material. So here's a fingerprint with some cross creases. You see some cracks going up and down and sideways. Here is good fingerprints, very deep, nice deep grooves. Notice they're pink also. Here is very shallow fingerprints, and you can't almost see where the grooves are, and all you see is crisscrosses up and down. And these are people that can't get fingerprinted. The FBI has a hard time with them, the police. I have one patient, she couldn't get a job with one of these agencies because she couldn't be fingerprinted. Here is the extreme of the same. And shallow, shiny, barely any grooves, mostly wrinkles. The vertical wrinkles, the up and down wrinkles, usually are relating to dehydration as well, whereas the cross wrinkles across the pad, the horizontal, very often relate to the protein quality, but they'll both be there if the protein's bad. Here's a lady that you could see on your left. It's more dusky, and she had very lousy adrenal function, very lousy connective tissue function. After her adrenals got strong again, this is 5 months later, you take a look, and not only is she more pink, but also take a look at the grooves. You see all the grooves deep, and the cross creases are gone. So we could take a look at our connective tissue quality directly. Adrenals do's and don'ts. Eat food People say, what should I eat? I say, eat food. They say, well, come on, really? I say, eat food, I explain to them, what I used to tell my kids when they were growing up, there's no such thing as junk food. There is junk and there is food. So eating food is a good start. And, drinking enough water, fat, nut oils, proteins, avoid the sugars. For people with weak adrenals, frequent meals tend to do better than sparse meals. Cleanliness, detoxification, joy, hobbies. When we fix the adrenals, usually it's we have there are 3 phases that I sometimes will go through. One is the crutch, which is the immediate, let's pull you out of the fire today. And that is, I will use adrenal supplements to do that, especially glandulars. I use a lot. And the next phase, which they sort of overlap very often a little bit with each other, is facilitation of good adrenal function. And that's, there are some herbs that I use, or amino acids. Make sure that their digestive function is good. I use digestive enzymes with bile. I make sure that they get good nutrition. That's the most important thing. You've got to keep the nutrition going. And then over the long term is rebuild. Make sure they have their amino acids, their fats, all the materials they need to rebuild their adrenals. As far as fixing the estrogen dominance, we have 2 phases. One is cycling women, and the other is postmenopausal. If it's cycling, we adjust the progesterone to support according to what part of the cycle they're in. It's not a one-size-fits-all. What I normally tell my patients is that in the first week or so, we use a very of the cycle. Use a very tiny amount of progesterone, just enough to replace what you need. Because remember, the estrogen dominance, the PMS, can take place anytime during the month. So if you have symptoms of PMS, or if you have symptoms of estrogen dominance, replace a little progesterone. It jumps up from maybe 3, 4, 5 milligrams a day to about 15 or 20 milligrams a day at mid-cycle when we ovulate. And we keep it like that until we have a period. That 15 or 20 is not carved in stone. There's a fluctuating need. Some women are very small, or they need very little. Some women are very big, they need a lot. Also, if you can have a small woman with a severe dip in her progesterone, and she needs a lot more than the large woman that doesn't have a big dip. So it really has to be navigated by how it feels, and you have to learn what it feels like. Remember what we talked about before. Too much progesterone is going to give you too much sedation. If you're getting a yeast infection, you're getting too sleepy, you've taken too much progesterone. If you're having headaches, anxiety, tension, cramps, breast tenderness, you are not having enough progesterone. I don't care what the calendar says, you're not having enough progesterone. So you've got to navigate according to your own personal need. There's no one-size-fits-all. But in general, the first half of the cycle is low dose, second half is a higher dose. And some women even need it during the period because they have PMS during the period. It means that they don't have enough progesterone at that time. But the amount you need at that time, your estrogen levels are very low, so you only need maybe a couple of milligrams to counterbalance that low level of estrogen. With menopause, I like to give a steady amount of progesterone. I don't like to cycle. Postmenopausal women were not designed by nature to cycle. They were designed by nature to have a steady state, a steady level of a very low level of progesterone, but it's a steady state. The problem that most women have is that they have even less than that, and that's where they get into trouble. So you've got to replace some of that, 10 to 20 milligrams a day. You could split it up between morning and night, or just do it. You could do it at night, where it helps to sleep. Now, if you put it on thin skin where there's no fat, it'll go in right away, and it's out very quickly too. If you put it where there's more fat, avoid the stomach because it'll draw fat to the stomach, but you could put on your legs and your arms. What then happens is that you have, it soaks into the fatty tissue and releases slowly over a number of hours, and you can have a much better night's sleep. The catch with postmenopausal women is that if they start taking progesterone, and progesterone, by the way, helps to protect us from cancer. It doesn't give us, it's the estrogen that gives the stimulation to the cells. Progesterone is the opposite. And a lot of doctors that are unfamiliar with any of this will say, oh, avoid all hormones. Well, it's like saying, you're in a car and say, avoid all the pedals because, I know one of them can give you cancer, one of them can give you an accident, but, just avoid the pedals. Well, should I avoid the brakes too? Okay, so, anyway, so what happens, though, is that there's a paradoxical effect. I just wanted to make sure that everybody knew so nobody gets into trouble with this. If a woman is low in progesterone, postmenopausal, starts taking progesterone, you've got to start with a very, 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 very tiny dose because there's a paradoxical effect where the progesterone will stimulate both estrogen receptors and progesterone. And initially, the estrogen more than the progesterone, but that gets tired out after a few weeks. So we increase the progesterone level a tiny, tiny amount every day. By the end of the month, hopefully, we could get to about 15 or 20 milligrams a day, and we never really got slammed with an estrogenic effect. Otherwise, I have a lot of women that will start with a full glop of, cream, 20 milligrams, and they stop after 3 days. They come back with complaints. They say, this is terrible. I'm getting all my symptoms back. I got headaches. I got breast tenderness. I got anxiety. I didn't sleep all night. And that's because they're talking about the estrogenic effect. So we start very, very, very low, and we build up. For hormone replacement, if they need hormone replacement, what I like to use is bioestrogen, which is estriol and estradiol. I do not ever use synthetic hormones. The Premarin is made from horse urine, and it really is very good for you and physiologic for you if your diet consists of hay. But if you are a human, then it really, really is not good for you and can promote cancers. Over here, this is just to show you the pathway. And if you look at the top of the hormonal pathway, you notice it starts with cholesterol. So when we knock out our cholesterol, we have a much lower level of all the other hormones. The cholesterol will enter the hormonal pathways by becoming pregnenolone, which then converts to progesterone, which converts to almost everything else, including, if you look, it goes to the right, aldosterone, cortisol, and most of the other adrenal hormones. So progesterone is very important, and if you don't have enough progesterone, your adrenals are going to suffer. One thing that is important to understand, and I just want to make this little point, is a lot of women, when they have infertility, they go to the doctor, fertility doctor, and the doctor tries to force ovulation, force fertility, etc. Not a good idea. Mother Nature has it designed very well. We're either going to survive the day or we're going to survive the generation. So if there's a lot of stress, a lot of the progesterone, as you see, will get shunted towards the adrenals, aldosterone, cortisol, etc. If there isn't a lot of stress, then you have all that progesterone going towards the sex hormones and promoting good ovulation and fertilization. And it's going to be one or the other. So the first thing to do to help yourself with fertility is to make sure your adrenals are healthy. And once that happens, Mother Nature says, okay, I don't have to divert all that progesterone. I'm going to go straight down and support the reproductive system. And that's the best way to go, because then you have not only a healthy mother, you have a healthy child. Everything works much better. Okay, so now I want to talk for a few minutes about something else. We're going to be talking about Lyme, but before we talk about Lyme, I want to talk about a little bit of an awakening that I had when I took a trip to the Amazon, and I learned something very important. I was hoping to, I went there with a friend of mine who visited a very remote village, the Yawanawa tribe, and it was during their annual festival, and I sort of had a feeling of what Weston Price saw when he went and visited the tribes that he visited. But, I went there to see if I could help them, but actually they helped me a lot more than I helped them. I learned so much more from them. And I'll show you a couple of pictures, then I'll explain. The first thing that I noticed was the children are not only happy and playing all the time, they're all taking care of each other. They're walking around hand in hand. She has the celebration holiday painting on her. They paint themselves like that for the celebration, for the holiday. Here's wherever you went, you saw children holding hands like that, and they were playing with each other. Really, really. What struck me was the youngest and the oldest in the tribe. There were a lot of old people, but there were no elderly people. Here is. Okay, whoops. Okay. These are two kids that those little huts in the back are huts that they built for us when they knew we were coming, because they figured we can't sleep like them. But they're all made out of grass and, branches. They did a nice job. But here are two little girls that I saw. They were playing, and I just took a picture. The grass skirts are, I guess, their holiday dress during this time, and so is the feather headdresses. We're using that. They wear those things, and they're painting on their body. They use that like we use suits. This is the other little girl. Sweet kids. They're beautiful children over there. Here's another. And they were all always together and playing with each other. It's just the most amazing thing. I stayed there for about 10 days. I didn't see a single incident of a child being disciplined. It was just ridiculous. This man over here that you see walking rapidly as the other people are dancing, their tribal dances. This man right here, his name is Yawa. He's the shaman, the medicine man. He's 98 years old at the time of this picture. I want you to see what a 98-year-old person looks like, supposed to look like, when they eat well and live well. He lives on a Western price diet, by the way. Here's another picture of him holding a ceremonial spear. The man behind him with the yellow headdress is the chief, Nishiwaka. And where is that? There were a bunch of other people came with us, a bunch of Americans, as you could see, this fellow with the bathing suit. Here's me with Yawa again, the 98-year-old fellow, who was using a grass skirt for a hat. Very resourceful, and interesting fellow. This is him again. He was, by the way, the haze over here is not trick photography. It's somebody stuck their thumb in front of the lens when I took the picture. But he's 98 years old. He's standing over the cliff over there looking at some visitors that were coming. These are some of their games that they were playing. This one over here, there's an American actually in the middle. But what they do is one guy will grab a turtle, a big turtle, and then about 3 or 4, they start with about 2 or 3 of these ladies, young ladies would come and try to wrestle it out of him. If they weren't successful, another one joined the crowd. If not, another one would join the crowd. Eventually, he would give up the turtle. And then they did it in a reverse order where the women would get it. But over here again, and you see on the top row, their feet dancing around them, and here they are wrestling this turtle out of this guy's hands. They had about 50 different kinds of games they were playing. Very interesting. And I just took this picture because this guy looked so Indian. I mean, he looked so Amazonian, but amazing just to watch these people. And behind him is one of the visitors, of course, that came with us in the group. So let's talk about Lyme. One of the things that struck me was very interesting is that these people didn't have the diseases that we normally think of. The arthritis and all these, Alzheimer's. Like I said, I saw old people. I didn't see elderly people. This guy, 98 years old, acted like a 20-year-old. His eyes were sharp. His ears were good. His teeth were great. His reflexes were rapid. And let's put it this way, nobody got up and gave him his seat. If this guy wanted a chair, he went out there and he got a chair, carried it on his head, and put it down. He didn't. He thought he was 20 years old. And so let's talk about Lyme for a minute and how it relates. Why does it relate to thyroid adrenals? because one of the things that I found out is, first of all, I'm having a tremendous number of people come to me with Lyme suddenly over the last year, 2 years. It's almost like a tidal wave crashing at the shore. I don't even know what to make of it. And I'm testing them, and they're coming back positive. But also, I'm testing them in many other ways, too. Not just the blood test, but also the physical exam. And one of the things that I came to realize, and I'm going to talk about my own experience here. This is not official, standard wisdom. This is just my experience. First of all, the main vector is a deer tick, but other ticks can carry it as well. Also, other insects, biting insects. If we think that a flea can suck on a mouse or a deer or a dog that has Lyme and then not jump on us, and we get bit, and it's a sterile bite, don't worry, it's not a deer tick, so you're not going to get anything, that's ridiculous. I've had patients come to me with bullseye rashes after they've been bitten and watched themselves being bitten by all kinds of insects, including fleas, mosquitoes, spiders. One lady with a bite by a ladybug, very unladylike behavior, but I think that if the nervous system is irritated, then they can behave in a strange way. And she actually got the bullseye rash, and she watched the ladybug bite her, and she whisked it away. So if we think that, number one, biting insects can transmit the microbe. Number two, it's transmitted through the uterus from the mother. It is transmitted through breast milk. We're surrounded by it, and it's not just us. If we think it's just us, what about our parents, our mothers? What about their mothers? This thing has been around for millions of years. So, and I'm talking here about, let's give the benefit of the doubt to the fact, not the fact, to the idea that this may be a natural process going on. If we leave out all the conspiracy theories and the military theories and all that stuff, and let's just assume for the moment, for argument's sake, that this microbe has been around for millions of years, then we're all exposed to it all the time. Because somewhere along our ancestry, somebody got bit with this and had a baby, which the microbe was transmitted, and on and on and on. So we're surrounded by it. There are other ways of transmitting it too. If the animal has the microbe, the spirochete, and pees on the grass, the microbe, another way of transmitting is through the urine. And then next time around, when an animal comes to lick the grass for some reason, they pick it up and they get it. So there's so many ways of getting it. To think that we're living in a sterile world is a little bit ridiculous. I know that the entities that are telling us that it's only a deer tick that gives you this disease, I don't think they believe it themselves. They're just saying it, but I don't know why they're saying it. There were some studies over here that show spirochetes were detected in 1.7% of mosquitoes and 3.2% of their larvae. There were other studies that I've seen since then with showing 12% of mosquitoes, 15% of mosquitoes, and one in Russia that was done, a study that I saw which showed 30% of mosquitoes. The point is, if you've got mosquitoes, fleas, ticks, and God knows what, biting animals with Lyme and then jumping over biting you, chances are that we've been exposed to it in many ways we don't think about. And I'm just saying, I'm just looking at what's reasonable as a possibility. Now, a lot of diseases that we grew up with and we thought were not Lyme turned out to have a strong connection to Lyme. For example, grandma's rheumatism. Well, chances are it was infectious, and today a lot of my arthritic patients, actually turn out to be Lyme. There's other reasons too. You could have mycoplasma infections. You can have other infections. The one thing I don't do with arthritis is give steroids to suppress the immune system. Now, Dr. McDonald, showed that 7 out of 10 patients with Alzheimer's were shown to have Lyme DNA, when he was examining their brain DNA, their brain cell DNA. So, so grandpa's Alzheimer's might have been Lyme. Bell's palsy, Lyme. I had I just want to take a break for a second before I continue talking about that and say that one of the reasons I'm bringing this up is not only because it's so widespread and prevalent, and there's a lot you can do about it that's easy without breaking the bank here at all, but what I discovered once I saw this onslaught of patients coming with Lyme was that when I would check them physical exam and other exams for adrenal function, and they had very low adrenal function, what I used to treat as adrenals, if I would simply treat the Lyme, as the Lyme goes away, their adrenals became quickly normal. And what I used to see take 6 months to a year to repair with adrenals by just focusing on adrenals, I'm now finding that in 2 or 3 months I can get the same adrenal improvement by not even touching the adrenals, just by working on Lyme. So I'm giving a lot of my patients the herbs and the treatment for Lyme, and seeing amazingly good improvement. So because of that connection, and I know that many here are interested in having better adrenal function, I just want you to be aware that there may be another connection here. You have all these reports over here. I see over here another report, spirochetal isolates from several tick species and 1 flea species. So the thing is that, let's talk about, before I talk about the treatment, I wanted to mention one interesting patient that I had because it's so prevalent. A patient came to me with myasthenia gravis. He's sitting in a wheelchair. He's holding his eyelids up like this with his fingers because the eyelids would drop. He was told by a local, very, very well-respected hospital that he has myasthenia gravis, that he's going to die soon anyway. It's not going to, because he was going downhill and nothing was helping him. And they said, "You will never get well." And I looked at him and looked at his labs, and I said, "I think you have Lyme." And he said, "Well, it's funny. I just had a Western blot, and the IgG, IgM, all of them across the board came back negative." And I explained to him that if he's sick enough, they're going to show up as negative because he doesn't have the energy to make the immune globulins. So what I did was I gave him some herbs, and in this case also an antibiotic, and also some immune supporters. And 1 week later, we managed to take another test, a complete test, and it also included the Western blot, the IgG, IgM. This is 1 week after getting immune support, so his immune system could start to function well again. And I took him off the steroids, and the IgG and IgM were fireworks positive all across. It was ridiculous how positive it was. 1 week later. So the IgG and IgM, in case that's the test you're using, doesn't test whether you have Lyme or not. What it does is it tests your ability to make these antibodies. So if you have any kind of immune weakness, you're not going to make them. If the disease is too chronic, chances are your immune system is tired out and it's not going to make them, etc. It's only going to catch it at a specific, sweet spot. So there's another test that I use. It's by neuroscience. It's called MyLyme ID, and it's a type of ELISA test, MELISA, which is a memory lymphocyte immune stimulation assay, and it tests the white blood cells' response to the Lyme proteins. And that doesn't depend on our ability to to make antibodies. And suddenly we're seeing all kinds of positives all over the place. And in fact, over 90% of the time I see positives with my patients when I suspect Lyme, and I measure this, and I'm very, very worried because I'm hoping the test doesn't become illegal. It's really showing us way too much. Now, but the interesting thing is that I give these people a treatment and they start to become well in most cases. Oops, we're done, right? Okay, let me just take one more minute. Let me take one more minute. An easy way to work with it, there are herbals that you can work. Buhner, Dr. Buhner, B-U-H-N-E-R, has a very nice book out on Lyme, on healing Lyme. B-U-H-N-E-R. One thing that I found very useful is teasel weed root. And it's taken in very small doses. I can't give you the dose right here, right now, but I guess if you email me, I could give you information. But it's all over the internet too. It's very small. It's a few drops. You start with one drop, build up, build up. And what I found also, interestingly enough, recently discovered that if we take hot baths or in any other way raise our body temperature, you raise your body temperature 3 times a week for the first month or two, and then every once in a while. Raising the body temperature while doing this is going to really, really help to knock out those spirochetes. So, and people do get better faster. That's it. I have to go. I'm sorry. My timing was off. And are there any questions? Let's just one or two. Thank you. For those of you who want to stay for questions, go ahead. Otherwise, please, don't miss your lunch. Go ahead.
Test antibodies return to normal after treatment, and have you noticed eosinophils being high in Lyme at all?
The eosinophils, no, I haven't noticed an eosinophil relationship. The eosinophils will go up if you have parasites or if you have allergies. The test will very often become positive when you're getting well, as you're getting stronger, and then it'll become negative later, the IgG, IgM. I'm sorry, can't hear you. It'll give you tremendous die-off. You'll get very sick. You've got to go at your pace. You've got to go build up very slowly, the teaselweed, and don't go past your point of tolerance.
Hi, when you do test thyroids and adrenals over here on the other side.
Yeah. What? Yeah. I can't see you. The lights. Go ahead. Yeah. Go ahead.
When you do the lab test for the thyroids and adrenals, what kind of ranges do you look for optimal for free T3?
It's on my website. It's on my website, drrind.com, drrind.com.
And when you do the adrenals, do you do the cortisol testing or DHEAS or what kind of testing?
Sometimes I'll do a saliva test, the ASI test, the adrenal stress index, and that's mostly to make the patient feel happy. For me, as far as I'm concerned, adrenals are best diagnosed with clinically. It's by symptoms and by physical exam.
Thank you.
Thank you.
When you're addressing adrenal and hormone dysfunction, what do you think of pregnenolone and DHEA supplementation?
They're fabulous. Pregnenolone is very, very good for most people, and they benefit. The DHEA is tricky. Most people benefit. You have to make sure you don't make too much estrogen. And women especially need much lower doses than men. A woman can use anywhere from 5 to 15 milligrams. Sometimes I have to go up to 25, but that's rare. It is very helpful. It starts in the morning. Take it in the morning.
Was your temperature charting that you showed, was that basal temperature?
No, that's on my website. I talk about how to do it. It's I use a thermometer in the mouth. And I use 3 temperatures during the day, one 3 hours after you wake up, another 3 hours later, another 3 hours later, roughly. And I don't like to use the basal temperature because that doesn't tell you a whole lot. It's when Barnes decided to do that, when Brother Barnes decided to do that, there was a lot that, he was a pioneer carving the way. I've learned a lot since he did that. And, they asked Newton, how is it you're a man of such great vision? He said, it's because I stand upon the shoulders of giants, that I see so far. And Brother Barnes was extremely, extremely brilliant and helpful. But I just found that if I want to know what your real metabolism is like during the day, I want to see what it's like during the day. And that's how I do it. And that gives me a very, very good answer for people, whether they're healthy or not healthy, whether they're getting better. Okay. Sure. Adrenal. If your DHEA is low, I can barely hear you, but if the DHEA is low, it's adrenal.
Over here this way.
So you were talking about the adrenal, thyroid, this relationship.
Excuse me.
At what point
That's my timer. I'm sorry. Wait. I'm sorry. Go ahead. What?
it was written that low adrenal function can lead to autoimmune.
Yes.
So is it the low adrenal that leads to the autoimmune that leads to Hashimoto's? Is that how you're thinking that it works?
That looks like it's the case in many patients, but there are variations. If you have low adrenal function, you're going to have a hyper-reactive immune system. You're going to have more allergies, more autoimmune. But a lot of the autoimmunes now, at least from what I've seen recently, is the autoimmune, a lot of autoimmune diseases, I think, are Lyme-related. I notice a lot of these kind of things clearing up when the Lyme clears up. So, jury's still out. I don't know. I'm learning as I'm going on this one. Yeah. But yeah, I think you're right. What you said. You become hyperreactive. The question is, why is it targeting the thyroid? I think that one of the things I found out about Lyme is that it targets our energy systems, and that might be one reason why. Maybe the immunological battle is taking place down there, and we develop an immune response, immune reaction. Go ahead. Yeah, you're welcome.
You know that you can take questions as long as you like. So
Thank you.
you're welcome to.
Thank you. Yeah, thank you. I'm sorry.
I recently went into the doctor with joint pain and suspected Lyme, suspected numbers. I had a blood test for C4A, which was 11,000, and C7, which was 120, and my Lyme test came back negative across the board. I'm wondering where I would go from here if I still have the other blood tests that are not sure if I'm Lyme. So
Okay.
my blood test was, my Western blot was
Yeah.
negative.
The Western blot doesn't test you for Lyme. It tests your body's ability to make the antibodies for Lyme. And so, again, it's one of those things where it's our interpretation of the test that really is where the problem is. If you want to do the neuroscience test, the MyLyme ID, then that would likely find a positive in you. But either way, you could also treat yourself empirically. You could just try something very simple, a $12 bottle of teaselweed and hot baths, and start very low, 1 drop, add 1 drop to the dosage every day, so you end up taking 1 drop twice a day, then eventually 2 drops twice a day. And you may not be able to go more than a few drops, but the maximum dose is about 10, 15 drops. But you do that, you do a hot bath every 3 days or so. Get your body temperature up, and you'll find yourself going through some die-offs maybe. And if you do, then you know you've got it. I mean, that's one way to go. It's called diagnostic therapy. You give yourself the treatment for this, and if you're having a die-off, chances are you're having a die-off.
The die-off would be feeling
Anything that the Lyme causes can be a die-off. In other words, in your particular case with joints, you might have worse joint pains when you take this, and then you know that they're dying, they're releasing their toxins right there. Other people may have other symptoms, muscle aches, fatigue, brain fog, visual problems, disturbance. Whatever it causes, it's going to be worse. But then you make sure your die-off is as gentle as it can be, detox yourself as much as you can, with sweating, with drinking fluids, etc., vitamin C. And then you notice that it requires a higher dose to get the die-off. That means that you've killed off those many, and now you have to go in a little deeper. Diagnostic therapy. You're welcome. It takes several months of teaselweed to get this to get your stuff down. Oh, one thing that I didn't mention. I'm sorry that I didn't mention it. Is it seems like really where we are is a balance between our immune system and microbial load. And what happens is that we have, if our immune system is up here and microbial load is down here, we're doing great. If the immune system is down here and microbial load is up here, we're doing terrible. And we go to the doctor, and when we're sort of here, and the doctor says, oh, the tests are negative. You don't have Lyme, take a Prozac. Now, we go over here, and the immune system is down here, microbial load is here. Your tests are negative, go home. Now we're over here. Well, you know, you're almost ringing the bell, but it's really negative, so I can't treat you. So take a Prozac, go home. Now we're over here and go, oh my God, you got Lyme. You know, so the thing is, we try to bring this immune function up, and we try to bring the microbial level down. And when we start to do this, we start to feel well and become healthier again very quickly. And it is a matter of months. And if you could detoxify yourself, especially through sweating, you know, saunas and things like that, detoxification is a very, very good thing. That's what you saw what 98 years old looks like when you have a non-toxic life? Okay. Yeah, go ahead, yes.
Are cracked feet, cracked heels, anything to do with adrenal?
Not necessarily, but they may have to do with your essential fatty acids, omegas, etc.
I have a question about the Lymes. Have you worked with your patients that you've treated? Do their symptoms ever come back?
I haven't done it long enough to tell you that, because this tidal wave only hit me a little over a year ago. And yeah, I'm still trying to keep my lips above water with this one, and I'm just sharing what I'm learning. And I'll find out soon enough.
Can I just share something? I've
Yes.
worked with horses my whole life. It has become a huge issue with horses, and the treatment is antibiotics. But what I'm finding is my clients' horses have repeat episodes
Yeah.
over and over again. So is there anything
Yes.
that we can do for the horses?
Well, I'll share something with you. I'll share something with you about that. Number one is, remember this business with the balance? Okay, here's our so our immune system's down here. Our microbes are here. Let's give antibiotic. Now the microbe is down here. But we didn't do anything to the immune system. What's happening? We stopped the antibiotic. Microbe takes a look over at the other side. It goes, I can handle this, and starts to go up. Okay, so then it keeps on going up and down. The only time I've seen people that over years, you know, when they got rid of it and they kept it away, is when they did this, when the immune system went up.
So the horses need to get immune boost.
You need to support their immune function. I don't know how you're going to do that. I don't know much about horses. But with horses, it's been a problem for decades. It's not just, it's more now. Maybe, I don't know, maybe they're getting... Yeah, and just like dogs, you know, I know a veterinarian, and he told me that half his dogs test positive for Lyme, and the other half are just false negatives. But the thing is that teasel, you might want to consider it, but very gently. And I don't know what the dose for a horse is, but the way they discovered teasel is this guy saw that somebody saw that, you know, that deer were using their hooves to dig out the roots of these weeds. And they were eating them. So, well, okay, it's making them feel well. What does a deer have? Okay, maybe it's for Lyme. So, making them feel well. So they start to see, well, what's going on? And that's how teasel weed was discovered. And sure enough, we take the extract and it makes us feel good. So maybe if it's doing it for deer, maybe it'll do it for horses. They're more related. But careful. Yeah, you don't want them with a die-off reaction. You know, they'll be upset with you. You know. Okay. All right. Yes. Yes, reverse T3 that's really high. There's two things to do. This is a loaded question. It's like, can you teach me how to build a bridge in the next few sentences? There are two main things to talk about with reverse T3. One is when the body is protecting itself from excessive thyroid energy, in which case what we want to do is not lower the reverse T3 or raise the T3 and circumvent the body's defenses. What we want to do is to enable the body to tolerate more T3. Give yourself better adrenals, get rid of the infection, do whatever it takes. The other is if you have a situation where you're resistant to T3, for example with Lyme, where you're resistant, the receptors are resistant, in this case you need to give T3 and you give slow release T3 twice a day. And you give just enough to get the reflexes to be normal. That's where you want to check those reflexes. You want to make sure they're normal, because I have some patients that have to have a very high or high-end T3 just to be able to function, and I know that I'm not doing anything harmful to them because those reflexes become normal at that level. And if I lower it a little bit, they're still at the high end of normal, but I lowered it a little bit, some of the reflexes are sluggish. And they're not functioning well. So we need that much. But what I find is as the Lyme goes away, their need for T3 starts to drop, and they come to me with complaints. I'm being hyperthyroid. I check them. Oh my God, got to lower your dose. So we keep on dropping and dropping and dropping the T3 until the T3 becomes normal, until you get everything working normal and they're no longer resistant to T3. Then you don't need the T3 supplementation. Yeah.
I've heard that 70% of the antibiotics made in this country are fed to healthy animals. We know at this conference where to get our meat, but society, a lot of people in society do not. What impact is the antibiotics being fed to these animals that people are buying in the supermarket? What impact are those antibiotics having on their immune systems? And is there a way, because I have a lot of relatives I'd like to educate, and we're not going to go on our diet, what way can they detox those antibiotics that are coming into their household through the
Well, first don't eat animals that are being fed antibiotics. And the thing is that they're being fed antibiotics because their immune systems are so weak, because they're so abused. So that's why, you don't give them antibiotics, they're going to die. But what happens with the antibiotics, obviously, is you're developing resistant strains all over the place. And that's one of the reasons the antibiotics don't work so well with us, because when you need to take chronic long-term antibiotics, you're going to find that strains of whatever strain you're working with, all these strains talk to each other. They exchange DNA. They become resistant to the antibiotics very easily, and all you're doing is killing off your good bacteria and not really harming your bad ones as much as you think you are. One exception to the rule is tetracycline, actually, which is a natural antibiotic, believe it or not. It's been around forever, and that one seems to work well without developing a lot of resistance. But I'm not a big fan of antibiotics. I prefer to just boost the immune system, and I don't know what else, what harm it's doing otherwise. There are many ways of detoxifying these out of the system, yes. For example, saunas. There are a variety of different sauna techniques that you could do. Sweating out, you could sweat out almost everything out of your body. Sweating it out, heavy metals, chemicals, everything. There's a vitamin C, high-dose vitamin C that I use in my office with my patients that does a very quick flush for all kinds of chemicals, whether it's petroleum or other chemicals, biological toxins. But sweating is probably the best way. It's nature's way of getting rid of toxins. Yes. Okay, I couldn't go into it in detail right now, but when people have weak adrenals, they usually have hypoglycemia. They often, because they don't make enough cortisol. And the cortisol is what raises our blood sugar. So we can't adjust our blood sugar by adjusting our cortisol because we can't make enough cortisol. In which case, we need to have adrenal support, and there are a variety of different ways. Even licorice can help us maintain a higher cortisol level, but it's not so easy. If somebody has hypoglycemia, there are so many other factors involved. Could be allergies, could be other things, and it's not so much the thyroid here. We're talking about adrenals, and if we could just get the adrenals stronger, the hypoglycemia starts to improve a lot. If it's not improving a lot, we've really got to find some other reason why this is going on, whether it's an allergen or an infection in the body. Yeah. With standard what?
Standard medical.
Oh, okay. Antibiotics, yeah. Forget it. Yeah. One of the problems with treating with antibiotics also is that you give yourself yeast infections. You're guaranteeing a yeast overgrowth. There's a product that I use. It's called Florastor. It's Saccharomyces boulardii. And that helps to, it's a friendly yeast that keeps away the bad yeast. You take one pill twice a day when you take antibiotics. You also have to replace the acidophilus, the good bacteria, when you do this. But if you don't take a protective measure, you're going to get yeast overgrowth, number one. Number two, chances are the antibiotics did not treat him unless he got antibiotics for months. And even then, it's going to come right back. Remember, the immune system's down here. That's why he got whacked. Now, if he got a tick bite, that could have raised the microbial burden so high that it knocked out his immune system, and now you have a balance like this. Still, you get rid of the microbe, you still got to do something to support this side of it, the immune system, and you bring it up. So we've got to support the immune system. There are a number of different ways that, I mean, you could email me and I could try to tell you, but there are a number of different ways to support the immune system. Detoxification and good diet are probably the best all-around way to do it. There are other things, there are mushrooms and things that are immune boosters. But you've got to do that, and the T-cell, you could pretty much bet that the Lyme isn't gone. But the problem is not only the Lyme, it's also the co-infections. Most of the people that have Lyme will have a co-infection. The insect is not sterile. The insect is carrying other infections with it, and they'll have Babesia, Bartonella, Ehrlichia, Rocky Mountain spotted fever, all that stuff. Yeah. So you've got to get rid of those things too. Get the book by Buhner, by the way. You might learn a few things about in regards to that, but you may need antibiotics for the co-infections. Either way, there's no substitute for having a strong immune system. You do that, and everything else starts to fall into place. Women use lower doses than men. A man can take 25 to 100 milligrams. A woman can take 5 to 25. That's like building a bridge in 2 seconds. If you want to, the best way to go for somebody like that is you take a low dose DHEA, 5 or 10 or 15 or whatever works for you every morning, and you see how you feel with that. And if you're feeling better, then you're probably doing the right thing for yourself. If you're feeling worse, then back off on a dose. You may only need 5. Pregnenolone is usually the safest bet because that'll become DHEA. It'll become all the other hormones. It's almost like taking cholesterol, but it's like taking cholesterol that is forced to go into the hormonal system. And you're going to make hormones out of that. But if a woman has a tendency to make a lot of estrogens, then she's got to be careful. And I can't tell you how, right now in 2 seconds, I can't tell you how to do that. One of the things that I do is I use thermography. I have a thermography camera. And the women very often will get the thermograms, and if you see all kinds of blood vessels all over the place, chances are they're estrogen dominant, and I would not give them more estrogen or anything that will generate estrogen. I measure their estrogens and so on. Sometimes they could get rid of all these vessels and the hyperactivity in the breasts by simply making sure they have enough progesterone. And a lot of times you will have excessive estrogen in the body from what you take, the DHEA, or even if you don't take it, regardless of what you take, excessive estrogen, because of dysbiosis, intestinal dysbiosis. If you have the wrong bacteria in the bowel, you will make a lot of estrogen, because the way the body gets rid of your estrogens is by conjugating it, combining it with glucuronic acid, and the combination, the conjugated estrogen, then very often goes through the bowel and is gotten rid of. But the bad bacteria will break the bond and deconjugate the estrogens, and then they get reabsorbed right back into you, and now you have a whole lot of estrogens floating around, and you become very estrogenic. And so the dysbiosis is causing that. We get bowel health to be restored, and then suddenly the estrogens will go down. And that goes for men too. I've had actually men grow breasts, and what we have to do is fix their gut, and then suddenly they're back to normal. Okay, anything else? Okay, thank you very much. That's it? Thank you, thank you.
So the theme of this year's conference is the politics of food. How did we go from peripatetic dentists in the 1920s to probably the #1 political issue of this century? I often like to go back in time. In the 1700s, The great issue was political freedom. A lot of lives lost, a lot of wars fought for political freedom. In the 1800s, it was women's rights, and many women sacrificed a tremendous amount to obtain this. In the 1900s, it was civil rights, and in the 21st century, the big political issue is food rights, food freedom rights. How many of you are completely new to what we're doing, never heard me speak before? So there's a few of you here. So we're going to give a little background about Weston Price. Weston Price was a dentist who practiced in the 20s, 30s, and 40s. He was one of the foremost dentists of his day. And he wrote textbooks, he did research. And towards the end of his career, he embarked on a series of studies that ended up in this wonderful book, Nutrition and Physical Degeneration, which chronicles his research on healthy traditional peoples and puts forth his answers to the question, what is a healthy diet? What kind of diet ensures perfect dental health and by inference, perfect overall health? And his studies took him to many places in the globe. The first place that he went was some isolated villages in Switzerland, in the Lowenschul Valley. The only access to these villages was a footpath, too narrow for a wheeled cart, and he could be assured that their only foods were grown and processed right there, with the exception of salt, which they had to bring in. Now, everywhere that he went, he found the same pattern. Those on their traditional diets, and these diets varied enormously in their particulars, but those on traditional diets were virtually free from tooth decay and uniformly had straight teeth and broad faces. They did not suffer from what he called dental deformities. And by all that he could determine, they were blessed with excellent vitality, overall health, and even longevity. In the Swiss village, he found less than 1% tooth decay. No one had crowded or crooked teeth, and seemed like complete immunity to tuberculosis, which was the #1 disease of the time. The diet in the Swiss village was based on the food that had been accused of causing tuberculosis in the world. It was raw milk. These people consumed raw milk, raw cream, raw butter, raw cheese. It was a very high-fat diet. And the other main item in the diet was a dense sourdough rye bread. Here's a wonderful photograph of the children from the village that was released by Price Pottinger Nutrition Foundation a couple of years ago. And it's a little bit hard to see, but these children have beautiful faces. They're round. They have high cheekbones, what we associate with attractiveness. Tall and sturdy. They played barefoot in the freezing cold waters coming off the glacier during weather in which he and his wife had to button up their overcoats to the top button. The men in the village were noted for their great physical prowess, and the women were noted for their beauty. Here's a wonderful picture of their bread. The bread is a very dense sourdough bread that is not only takes a long time to make, it's made by a fermentation process. That's what sourdough is. And this is a theme that you find all over the world among traditional cultures. They fermented, in one way or another, they fermented their grains, because we now know that grains have many irritants and even toxins in them. And this fermentation process turned the grains into something that was truly healthy and life-sustaining. Part of this pattern was that he also looked at people who had been modernized. And these studies took place at the perfect time when there were still traditional primitive peoples left to study, but people of the same groups were being modernized. So he could see what happened when people began to eat modern processed foods. And the first thing that happened was tooth decay, causing a tremendous amount of suffering. The Swiss villagers went from less than 1% tooth decay to about 33% tooth decay very rapidly as soon as the road arrived and the stores arrived and the processed foods arrived. But it was the next generation that gave him the most cause for concern. And I don't think we're... Because as you can see, this is not going to work. Here we go. As you can see in the lower photographs, the children who were born after the parents changed their diet did not have faces that were as broad. And they suffered from crowded and crooked teeth, what he called dental deformities, and many health problems. He found this pattern among Native Americans. These are Seminole Indians in Florida. Beautiful facial structure. They look like princes and princesses. This nobility of facial expression is our natural state. This is what we're all designed to have. But whether that beautiful genetic pattern manifests has to do with the building materials. So it's kind of a partnership. The genetics, we had nothing to do with the genetics, but the building materials, that is the responsibility of parents and parents-to-be. This woman is from the same tribe, same genetics, but she was born after her parents changed to westernized foods, and you can see the narrowing of the facial structure. In the South Seas, Dr. Price found the same pattern, different specific foods, but these foods supported the beautiful facial structure and wonderful, optimistic, cheerful outlook on life. Great stamina. What he often referred to, we sort of laugh at this, but he referred to them as splendid physical specimens. Here are women from the islands, South Sea Islands. He noted all men look like brothers and all the women look like sisters, even if they were not related. And that's because the diets were so rich in nutrition that they ensured the optimal expression of the genetic potential. Very different foods here from the Swiss villagers. No grains, no dairy products. This diet was based on seafood, pigs. You can see in the lower photograph. The starchy food was taro root, which, like the grains in the Swiss village, were fermented before they were eaten. On the lower left, the very handsome young man there is having a snack. He's eating a sea worm. So these diets were all very different, but there were certain principles he found in all, and certain practices he found throughout the world. One of them was the use of special sacred foods for parents-to-be, pregnant women, nursing women, and growing children. And these foods were very rich in vitamins and minerals, especially what we call the fat-soluble activators, the vitamins A, D, and K. In the Swiss village, the sacred food was a special kind of butter that came from the cows when they first went to pasture in the spring. In the South Seas, the sacred foods was shark liver and shark liver oil, and they went to tremendous risk to obtain the shark liver. Always the same pattern. As soon as they were introduced to Western foods, they suffered from tremendous tooth decay, and then in the next generation, the altered facial structure, the narrowing of the face, and the crowding of the teeth, greater susceptibility to disease. Just a century ago, the wide, well-built face was the rule, not only among Native Americans, but upon European Americans. I've circled the one exception in this photograph, the one person who has a fairly narrow face. If you took a photograph of people today, Americans today, even athletes, you would find the reverse. The wide face would be the exception and would probably belong to someone who was born outside the United States. This is normal facial structure. These children may have come from an impoverished village, but they have the greatest gift that any person can have, and that is normal, healthy development and bone structure. What we're seeing today is widespread dental deformities. This is, it's just endemic. It's very rare for a child born in America to have normal dental structure today, and this is blamed on thumb sucking or soft foods or genetics, But this is not a genetic problem, or this is not caused by thumb sucking. These types of dental deformities are a nutritional problem. There's just the building materials for the body were not adequate to have a strong, wide palate for the teeth to come in straight as they are programmed to do. The teeth do tell the tale. When the teeth are straight, it's a sign that the entire body has been built according to the blueprint. It means there's plenty of room in the head for the major glands in the head, the pituitary, pineal, and the hypothalamus. The hypothalamus is the seat of impulse control. And what are we seeing in our children today? Lack of impulse control. We're seeing this in the whole culture. When the teeth are straight, it's a sign it's been good skeletal development throughout the body. You tend to see good posture, strong musculature, keen eyesight and hearing, optimal function of all the organs, and the brain and whole nervous system being requiring good nutrition as well. You see happy, optimistic people who learn easily. And finally, the pelvic opening is round, which makes childbirth very easy and painless. When the teeth are crowded and crooked, it's a sign that there's going to be compromise everywhere in the body, starting with the head and the space for the master glands in the head, skeletal structure, posture, musculature, eyesight, hearing, organ function, brain function, outlook on life, and finally the pelvic opening will be oval, making childbirth difficult and painful, even life-threatening. These are typical pictures of our children today. Most modern children have thin faces and they need braces to straighten their teeth. They're plagued with allergies and asthma that make their lives miserable. They suffer from behavior problems, learning disabilities, autism, emotional problems that make family life miserable. And we know that if this continues even a little bit longer, we are going to have complete infertility. We are definitely on the precipice. We are at the 11th hour, and it is absolutely fundamental that we turn back to traditional peoples and their wisdom about food if we are going to succeed as a race, as a society. In an era when most people in the world thought that traditional cultures had nothing to offer us, that it was all one way, the advantages of technology and the advantages of civilization, Dr. Price was emphatic that traditional cultures had more to give to us than we had to give to them. And that if we did not learn from their innate wisdom about creating health and creating health for generation after generation, we would die out as a species. And it is this realization of Dr. Price that motivates all of us in the Weston A. Price Foundation. Here's some of the beautiful babies born to mothers and parents, I should say, who were wise enough and loving enough and caring enough to put our dietary practices principles into practice, starting before conception, throughout pregnancy, during lactation, and then for their growing children. These children are a delight and a blessing to their parents, to their families, and these are our leaders of the future. Dr. Price formulated 3 principles of healthy traditional diets. We have added others, but I will just briefly go through these 3 principles. Number 1, there were no refined or denatured foods in these diets, and when we say refined and denatured, we include pasteurized milk, skim and low-fat milk, all of the industrial oils, protein powders, additives, artificial sweeteners. None of these were in the traditional diets. One of Dr. Price's most famous sayings was, "Life in its fullness is Mother Nature obeyed." Again, totally at odds with the scientific view of his day and the scientific view today, which is that there's mistakes in nature. And we're going to fix these mistakes. We're going to fix the mistake that Mother Nature put fat in milk and give children low-fat and skim milk for their lunches. We're going to fix the mistake that pesticides attack plants when the soil is depleted. And we're going to fix it by genetically modifying the DNA of the plants. Dr. Price said, no, no, no. There's more wisdom in nature than we can ever imagine, and if we do not honor that nature and that wisdom and obey Mother Nature's laws, especially her dietary laws, we will not live a full life. And all of these factory foods are not Mother Nature's foods. Second principle, every diet contained animal products. He had hoped to find a culture that did not use animal products. Instead, he found a tremendous emphasis on animal products in all of these cultures. And not just the lean meat. The real emphasis was on organ meats and fats from the animals that they hunted and killed. Even if you are not eating meat, we use many parts of slaughtered animals in our culture for everything from cosmetics to plastics to modern building materials to the membrane in your telephone, which is made from beef gelatin. So we cannot escape our dependence on animal products. And our theme is the politics of food, and this whole issue of vegetarianism is extremely political, and forces that we cannot even imagine are pushing everyone towards a vegetarian or vegan diet. I think it's important to realize where this came from. The American Vegetarian Society was founded by Sylvester Graham, who advocated a whole grain vegetarian diet for moral reasons to promote chastity and curb lust. And he preached that the cause of all disease was excessive sexual desire, and hence the whole grain vegetarian diet, which is actually very effective at curbing lust because it dampens libido. John Harvey Kellogg followed. He was a very influential man, and he promoted this high-fiber vegetarian diet to combat the twin evils of constipation and natural urges, and preached against sexual activity even in marriage. Now, we have gone through the so-called sexual revolution. We've kind of thrown off this old fogeyism. We realize that if we suppress natural urges, they reemerge in pathological ways. So all that has, a little, I would say, behind us. We have a much healthier attitude towards natural urges today. But the diet they advocated is still with us, now enshrined as national policy and continuously promoted for moral reasons, to make you a better person, a more spiritual person, to save the planet, to stop greenhouse gases, to stop global warming, always with this moral purpose behind it. The third principle was nutrient density. These diets were very rich in minerals, and we talked till we're blue in the face on this. The fat-soluble vitamins, especially A and D, which are found only in certain high-fat, high-cholesterol foods, the very foods that have been demonized and that most people are afraid to eat. We're big on animal fats. What's so political about animal fats? If just 5% of the population went back to using these healthy traditional fats, especially the animal fats like butter and lard and tallow, it would send the food industry toppling. This industry is based on vegetable oils. Their profits come from vegetable oils. Our agriculture, corn and soybeans, vegetable oils, and all of the byproducts of these two crops, which are grown first and foremost for vegetable oils, animal feed, high fructose corn syrup, soy protein isolate. These are the residues left after they get the oil out of these seeds. Or these are the products that have pushed this monoculture, genetically engineered industrial agriculture. Butter consumption at the turn of the century in 1900 was 18 pounds per person per year. It dropped to a low of about 4 pounds per person per year in about 1980, and now it's creeping up. Last I heard it was somewhere between 5 and 6 pounds per person per year. So what? This change in our habits, which I think we have helped to promote, has the food industry in a panic, an absolute panic. So what are the political implications of the return to traditional foods? One is that a lot of it is direct sales. That pulls money out of the global system and keeps it local. That shrinks the pool of money that the industrialists have to spend. It brings prosperity to small farms and not to commodity agriculture. And when I say commodity agriculture, it's not just the crops, it's the pesticides, it's the fertilizers, it's the big tractors, it's the banks that loan money to all of these things. So it would mean a huge, huge shift in where the money is going. It would mean healthy people, which shrinks the medical and pharmaceutical industries. You think they are concerned about this? They very much are concerned. And finally, it puts the emphasis on individual responsibility for our health, which means that we can't blame our poor health on what I call the 2 Gs, genes and germs, but only on ourselves and our food choices and agricultural methods. Opposition. The opposition is very strong. Number one is food safety and animal ID legislation. Any of these types of laws fall very heavily on small farms. We have put a lot of effort into fighting this kind of legislation. We're seeing continued, almost shrill propaganda against animal fats, raw milk, butter, cod liver oil, all the healthy foods we advocate. Just to give you an example, we have been harping on the theme that without animal fats you get infertility, that the vegetable oils lead to infertility. And just the last couple weeks, 2 studies come out, lots of publicity saying that saturated fats lower sperm quality, damages sperm. And the studies actually did not show that, but that's how they're presented to the public. So we always know when we hit a nerve when we see what kind of studies are coming out. And finally, ambulance chasing lawyers are now focusing not on, asbestos or things like that, but they're targeting now raw milk, raw cheese, and artisan products. The future, I see in the future the separation into 2 food systems, an industrial food system, and then those who have opted out and are buying local. I see our organic, non-toxic, grass-based, and biodynamic farms providing not only healthy food, but a haven for those opting out of the mainstream. I believe that one of the services that these farms will provide is a place for 2 or 3 or 4 more families to live, even in straitened circumstances, because there is definitely going to be a separation. Finally, legal protection for the farms and lifestyle that we are choosing is absolutely necessary and something we must support as much as we can. The Weston A. Price Foundation's main purpose is nutrition education. We are teaching people why it is so important to eat this way. We are creating customers for these wonderful small farms. Finally, I want to put a lot of emphasis at this conference on the Farm to Consumer Legal Defense Fund, because without their work, we may not have these farms. It has turned out to be the most important thing we ever did, was set up the Farm to Consumer Legal Defense Fund. And I would like to ask for each of you, as a way of saying thank you for what we have done, because a lot of people have come up and thanked me. The way you can say thank you is to become a member of the Farm to Consumer Legal Defense Fund. The consumer membership is $50, and we simply cannot provide this legal help that we need to provide to these farms unless we have tens of thousands of members of the Farm to Consumer Legal Defense Fund. So that is my parting message to you about your role in the politics of food.